If you would introduce yourself, state your party affiliation, and describe the geography of your district and the district number, that would be great.
Great. My name is Lisa Reynolds. I use she, her pronouns. And I am running for state representative to be reelected to House District 34. House District 34, I think of it as kind of the northeastern part of Washington County. It's mostly unincorporated Washington County, with a big chunk of its area north of Highway 26, from about Cedar Hills over to 185th, and then south of 26 I have the Five Oaks neighborhood of Beaverton and a little corner of Hillsborough.
Not a Portland.
Nothing in the city of Portland. Of course, I have a Portland address, but I live but nothing in the city of Portland.
Okay. If you could briefly give us your bio, where you grew up, what you do for a living, anything in between those 2 points as well.
Great. So I grew up in the Midwest, in Chicago, suburbs of Chicago. You can still sometimes hear it in my voice. Went to high school and college in Chicago, then moved to Los Angeles to go to medical school, and did my medical school and pediatric training in Los Angeles. Moved up to Portland, took a job at Emmanuel Hospital for 1 year, kind of training, teaching role, and then I joined the Children's Clinic 29 years ago, where I've been a general pediatrician ever since. And then in 2019, I decided to run for office for state representative for the 2020 election.
Is the Children's Clinic affiliated with Legacy, or?
It is not.
It's independent?
It's independent, thankfully.
One of the few.
You know, here's the interesting thing. Pediatrics is probably one of the only primary care practice style that can remain independent, and it's because of our payer mix. We still have quite a few patients who are private pay. We have a lot of Nike and Intel families and other local employers in the area. And although, of course, we take Medicaid and we put no cap on that, you know, with that payer mix, we can make it work. Kind of the dirty secret about taking care of adults is such a big chunk of your practice is Medicare. It's hard to make that pencil out unless you're getting subsidized by the hospital. It's a real problem in how we reimburse healthcare. That's probably a whole other topic, but it's a real problem. We don't pay primary caregivers what we should be paying them for the care they give. Instead, we subsidize them, and then they become referral sources for the ENTs who do make money for a hospital or health system. It's very
screwed. A lot of bad incentives.
A lot of bad incentives, exactly.
So you're hoping to come back for your third term.
Correct.
What did you do in your second term that would make voters want to bring you back? Could you talk about a couple of bills that you sponsored or worked on if you weren't the chief sponsor?
Yeah, great, thank you. I was chief sponsor in the bill that I'm proudest of. It's a bill that we passed in 2023, and this establishes a child tax credit for low-income Oregon families. So families who make less than $30,000 are able to get a refundable tax credit for the kids in their family 0 to 5, and I want to say it's, oh my gosh, I think it's $750 per child per year. I'm embarrassed to say, we played with so many different numbers, I can't remember if it's 500 or 750.
So that's different from the federal earned income tax credit?
Yes, it's different from...
So this is a state level version of the EITC? Or?
No, it's a state level version of the, just the straight child tax credit. The earned income tax credit is another refundable tax credit that privileges low income families with children. So this is separate. So there was a federal child tax credit that Biden augmented and expanded and made it monthly payments, and we saw child poverty drop by half in the summer of 2022, I believe. Really amazing, you know, across the board. It solved the problem for so many families, and obviously research showed that families were using the funds to pay for food and rent and clothes and fixing the car and an occasional birthday gift. That has gone away. It keeps being brought back up for renewal. Strangely, the U.S. House passed reinstating the enhanced child tax credit, and the Senate has put it kind of on hold. So there's the earned income tax credit, which has a state and local component in Oregon, and then there's a child tax credit that is separate from the earned income tax credit that had only been federal, and then we brought it a statewide child tax credit.
Got it. Were there any no votes on that?
Oh my
I could
gosh,
look
it was
up.
very popular.
Yeah,
It was
I figured.
very popular. Yes.
Okay.
Yes.
What else did you do?
We passed a gun violence prevention bill. It started as a fairly bold bill, I thought. It did get whittled away in the 2023 walkout. It ended with being outlawing ghost guns in the state of Oregon. And these are guns that are either undetectable because they don't have metal in them, and they are certainly unregistered and untraceable.
So, I mean, since they're unregistered and untraceable, weren't they already they weren't legal to begin with, right?
So strangely, they were not illegal. Because people were making them themselves.
So they didn't
through
really
printers.
acknowledge something has to exist before you can say it's illegal. Or
Right.
Yeah.
Right.
Okay. So,
Right.
Okay.
So now they have to be serialized. People have to go through background checks when they go to like register the serial number or get it serialized. Then the background check happens.
What has surprised you the most?
I have a third one though. Can I
Okay,
have a
go
third
ahead
one?
first.
And I am so bad at remembering bill numbers, but our reproductive health bill in 2023 was something I'm particularly proud of. And I will say it's possible that the gun stuff got traded away to preserve some of the protections in the reproductive health bill. And this makes Oregon the best state in the country for abortion care protections and access. And we've also protected the right for families to seek gender affirming care for their young ones. So I'm really proud of that. As a pediatrician, I see the direct impact of that.
Okay.
Sorry,
Great.
go ahead.
I'm just wondering what has surprised you the most in your tenure so far.
I would say, and this is something I've been told, the vast majority of our bills pass with wide bipartisan support, and we agree on much more than we disagree on. And I had heard that, but to really see it in action has been really fun. I will say, though, the tensions that arise on the divisive bills have been harder than I imagined, because the comments, for example, on the floor of the Oregon House start to feel very personal, the way they talk about the folks bringing this bill forward. And these are people who I consider colleagues, if not friends, and I still find that disconnect very challenging. Whether they truly believe that I don't care about children, or they're just saying that because they have to say that for their voters. Either option is hard for me to accept.
What's the biggest mistake you've made so far?
Oh, I continue to sometimes make the mistake of not really reading a bill before I sign on. Certainly, if I'm going to sign on as a sponsor or a co-sponsor.
So what did you sign on and then have signers regret about?
Yeah, so I will say, actually, even before I took office, I agreed to be a co-sponsor on a bill that expanded the scope of practice for optometrists, and it kind of made sense to me. I talked to the optometrist, and then, within a few weeks I had ophthalmologists calling me, and it felt like it was more, and it felt little more than just a scope, or get it creeping into my, there were safety concerns they had, and so I took and plus the bill did more than what I was told it did because I didn't read it. And so that was one of my really early mistakes. I took myself off the bill. I called everyone, including the optometrists involved. Most of them were like, wow, how nice that you're calling me to tell me this. I'm like, of course I am, So I think just anytime you take a little bit of a shortcut around there,
Those seem to be some of the most bitter battles that don't have to do with abortion and guns. When psychologists wanted to prescribe, or when naturopaths wanted to prescribe, or when masseuses and acupuncturists fought over who could use a needle, those
Right.
expansions of scope seem to really, because we're talking about people's wallets or patient safety or both.
Right. Here's what I think. I think it's hard to put it towards 90 people who are not experts in healthcare, right? And so I think it was Maxine Dexter proposed a panel that helps with these scoping conversations, right? That we have kind of independent people helping make kind of uninterested, right, decisions on what truly makes sense for access to care, patient safety, affordability, right? I don't think those should be made among lobbyists dueling for the hearts and minds of individual legislators.
So kind of related question. What do you feel about Oregon potentially joining a physician interstate licensing compact?
I am in favor of it.
You're in favor of
Yeah.
it. So why do you think Oregon has struggled and doesn't really, I mean, I would say it doesn't even seem really close to joining one. So why are we struggling on that?
So I have to admit, like, this has come up a lot in the last few weeks, and it's not something that has been on my radar so much, maybe because it's just been squelched. So I really want to sit down with the Oregon Medical Board and the OMA and ask, tell me what's going on here, right? Especially as we know that there are people who don't have access to adequate care in our state. So, and I will say, I mean, they may be able to change my mind. I mean, I will talk to them with an open mind, but I haven't heard their arguments. I hope it's more than just, pocketbooks and battles,
Yeah.
but I am interested in certainly learning more about it.
Okay,
I haven't done the work yet.
I don't know how closely you've talked to Representative Sanchez about the alcohol tax proposal.
Yeah.
But how are you in favor of her current proposal, or?
So I don't know the details of her current proposal, but overall I've been in favor of raising taxes on alcohol.
And would you be in favor of moving those proceeds to just be spent on child treatment services?
Oh, would love that, yes. I mean, we have definitely, as I think a lot about 0 to 5 spending, which is lower than it should be, we've definitely thought of where are the revenue sources for this, right? And certainly that's something we've talked about. We'd love to do kicker reform, but that's probably not in the near future. But and I do wonder if we had a powerful why, that people might be more amenable to perhaps raising taxes on alcohol.
So you have worked on flavored tobacco.
Yeah.
It's a little bit like alcohol in the sense that from a public health perspective, we know the harms of tobacco, we know the harms of alcohol, and we're seemingly learning it's more harmful all the time.
Yes.
A little depressing to me.
I know. You thought that glass of red wine was helpful. Yes.
Instead of joining the gym, I'm going to buy better wine. Why has it been so difficult for the Democratic majorities to pass a statewide ban on flavored tobacco?
So we brought it the first time, and actually, I'm going to be honest, we had the votes in the House. We hadn't started whipping the Senate. And I think the walkout blew that up in 2023. We will be back in 2025. And I will just tell you, folks who were skeptical in 2023 and gave me a begrudging yes, are like, I'm glad we're doing this finally. So I think, like so many things, it sometimes takes a second or third time. We certainly talked about bringing it back in short session and decided not to. But we are kind of all systems go for 2025. And I'm super hopeful. I may have a Republican co-sponsor, more to come on that one. So I think it's one of those things that it has to be aired around the building a little bit longer.
So we passed a preschool for all measure in this county.
Mm-hmm.
There's a little bit of money at the state level for what they used to call preschool promise, similar program.
Sure.
Now there seem to be some data that show that high-income earners are leaving Multnomah County because of the tax levels. The biggest single tax is the preschool tax. Meanwhile, 35 other counties don't have a similar tax. So as a policymaker, walk us through what you think. Are we in the right place? Are we in the wrong place? And if we're in the wrong place, what should we do?
Well, I sometimes, when you look at the history of education, right, I'm maybe going too far back for you, but, I think when the first Department of Education at the federal level started, it was like 1st through 5th grade. Then they realized actually we need 8th grade. Now we need 12th grade. Now we need kindergarten. Like, I think we need some true federal investments on those years before kindergarten. I mean, that's the true answer. That's obviously a very challenging thing to come towards. It's arbitrary that we start state supportive education at kindergarten.
Right.
So, and there's no question that a lot of kids do a lot better if they have 1 or 2 years of pre-K in terms of kindergarten readiness, 3rd grade reading scores, high school graduation rate, rewarding careers. So we definitely need to think about ways to get to some sort of universal pre-K. I have some families who tell me they're not that interested in pre-K, like they'd rather have their kid at home playing in the woods. I'm like, great. I agree. I think that probably is a really great thing for that kid. But we have a lot of working families where kids are in kind of mediocre childcare. So we have to come to a place, I think, as a country, to really acknowledge the importance of universal pre-K. As a state, it's unbelievably expensive. I'm not sure how we're going to do it.
So should we stay with the status quo where we appear to be having a slow leak out of Multnomah County and nobody else says anything?
You know, they did do a survey in Washington County.
I know.
Yeah, and it failed miserably. Yeah. And I'm like, but it's for the children, right? You know, but I get the fear on, and I have friends in Multnomah County who love Preschool for All, and they said that check's really hard to write, $6,000 tax bill, you know? So there's probably got to be some in between. And I'm going to get in big trouble for this, but I think when we talk about our K-12 budget, can we figure out how to roll in a pre-K budget there? I mean, I think that's almost the conversation you need to be having, which I'm sure will get me in big trouble with the K-12 people.
That's what we're here for.
Yeah.
So two of the state's biggest hospital systems may be merging. They finally filed some papers. Do you support that merger?
I mean, I think, you know, the argument I keep hearing is we'd rather Legacy become part of OHSU as opposed to being bought by the Centene or the Optums of the world, right? A venture-backed, you know, profit-driven. So I think, you know, it's probably the least bad of many options that were possible for Legacy. What I'm hearing from my friends on the inside at OHSU is they're very worried, right? There's already a big, somewhat arbitrary layoff of 500 folks. My friends in the world of pediatrics are concerned about keeping pediatrics special and different from adult medicine. We all have the saying, children are not little adults. You don't have one radiology department. You really need a separate pediatric radiology department. They're concerned with this expansion just in sites and physicians. Are we going to lose the specialness of pediatric care, which tends to not be a moneymaker? So I think, you know, in the scheme of what could, you know, it would not have been good for Legacy to just go away. It would not have been good for Legacy to be corporate, you know, profit-driven, venture capital owned. This is probably the least bad of a lot of different options.
Okay. Would you ask a question? Because I just forgot the next one. I had a question.
So it seems like the state is cracking down on a few the providers of essentially like K-plan services. And so do you think the state is doing a good job? Like, were you supportive of the state's kind of expansion of these services? I don't know how closely you follow this, but like to the new agency model, and like, do you think that money is being well spent?
I do oversee the House Committee on Early Childhood and Human Services, so I see and hear about this stuff a lot. I think the K-plan totally makes sense, right? To have folks with disabled kids have easier access to public funding of their child's very expensive care. And the state has totally fallen down on monitoring the safety of that care. I mean, whether it's individual providers and certainly some of these group providers, I can't remember the latest one, of some of these congregate care facilities. So I think, you know, it's, you know, and I think that the Department of Human Services would probably say we don't have enough inspectors, we're not able to do surprise visits as often as we would like. But no, I mean, I do think that some of our most vulnerable continue to suffer at the hands of folks who are unscrupulous and who aren't in it for the right reasons.
So I imagine as the head of the, I mean, you do have some control of the budget here. So like, I mean, is the solution that, because we hear this a lot, right?
Yeah.
Like long-term care or like,
Right.
you know, K-plan, just like DHS is struggling to kind of figure out what's going on out there. I mean, do you think the solution is they need a lot more money to kind of inspect these facilities, or is there another solution here?
I suspect the other solution is we don't want this to be a money grab for people. I don't know how you fix that, but we get into these desperate straits and then we're like, we will pay you this pretty big contract to take care of these severely ill, maybe mentally ill, 6 to 8 kids. And then we don't do the monitoring, right? So it's a little bit, I feel like sometimes the basic model is a little bit flawed in how we bring outside contractors. But the solution to that is to continue to greatly expand our state employees who take care of these people, like the SEIU workers, right? So I think that would be a little bit more ideal, but they also need to be making living wages. But there's a real disconnect. Like a lot of the workers are making, barely making ends meet, and then we do these very enriched contracts when we're desperate for a particular subset of patients.
I just want to push back because it seems in recent years the state strategy has been, instead of raising rates for the unionized workers, but to move to for-profit entities to employ them instead.
Right.
Do you feel that is the wrong direction for the state?
I think it has been the wrong direction. Yes, I think we're not seeing good outcomes from those.
Are you going to push the state to go in the other direction?
These are certainly conversations we're having. I don't know if we'll go so far as to say let's stop doing. I mean, they have severed so many contracts. They just severed their second one this year, right, with people taking care of vulnerable Oregonians. It certainly gives me pause that is a model we should continue with. But I can't say that I'm going in there and saying no more contracting out of these services.
Legislature referred two measures to the ballot.
Right.
Ranked choice voting and a salary commission. Ranked choice voting, how are you planning to vote on that?
I plan to vote yes on that. I think it makes sense, even as I'm terrified about the Portland,
So
the Portland ballot.
Why does it make sense?
I think it does help smooth out the traditional model of the closed primaries, where you have in the Republican primary you can get more of a right-wing person, in the Democratic primary you can get more of a left-wing person. I think if we could have open primaries with ranked choice voting, we could end up with two people that better reflect the values of the district.
But we don't have open primaries.
Right.
Nor is it on the ballot.
No, you're right. I'm probably conflating. So then would we get moderate people out of each primary if we had ranked choice voting in a Democratic primary and a Republican primary? I think that could be interesting. I think that would be better, for sure. I'm disappointed my Republican colleague isn't
But
here today.
legislature didn't recommend ranked choice voting for itself, so it's good for everybody else, but not for you.
Right. It's for the non-partisan races. I realized that.
So no open primaries and no RCV for legislators.
I would be interested in it.
Good for everybody else, but not for us.
Right. That's a good critique.
Okay, how about the salary commission?
I am a big fan of the salary commission. I was disappointed to hear that there's a news source that's against it, but I heard the Oregonians coming out against it is what I heard. I don't know if that's been published yet.
They don't share anything with us before they publish it. So one of the critiques that we have heard of that salary commission is it's totally unreviewable. Appointed by the legislature, no review. It says right there in the measure, not subject to review by any government body.
Oh.
Including the courts.
Yeah, that's, I did not realize that, Nigel. Thank you. I obviously didn't read it as carefully. Another example of me not reading it as carefully as,
Okay.
I mean, I certainly love the premise of it taking it out of the hands of the legislators.
Yeah.
And I will say, I personally, ran for the legislature after 20 some years of being a pediatrician because I had a big savings account that can cover me. But we want people like Ricky Rees. I mean, you understand the goal here.
Yes. No, I understand the goal. I'm not sure the method is
okay.
exactly right, but
it's a good point. It's a good point. We should all be pro review because it really makes you look like you're scared of something. Yeah.
So, we've heard a lot of people in this room, both this cycle and in interviews, talk about the challenges that the Oregon's mental health system faces, but we never hear about the physical health system, the outcomes for your patients or outcomes for people who are just in hospital for physical ailments. So what's that like?
I think, first of all, when we talk about healthcare, it's really sick care, right?
Mm-hmm.
The way that we take care of patients in this country is we wait till they get sick and then we, pick them up off the ground. I would really love to see a more robust wellness, preventative care where we are really incorporating more physical activity better nutrition in our schools and for folks on SNAP, better education on that. So I think overall, I'll tell you, besides the usual cold and flu and germs that everyone seems to have right now because they've been in school together for a month, the significant illnesses I'm seeing are related to obesity. They're related to, and their mental health is very tied with their kind of stagnant lifestyle, often very screen heavy. So when I think of how do we improve people's physical health, it's really going to those upstream. And that's, I always tell people, I talk about sleep, nutrition, and exercise with almost every patient I have in my office. And we're all kind of falling short on a lot of those things.
Does the legislature have a role there?
I don't know. The health plans might. But it's interesting. I don't know. I'll be honest, what I'm trying to do in my healthcare work is work a lot more on the mental health, understanding, but it's so intertwined with the physical health. It's a great question, though.
Can you give us an example? You talked before about the fact that most of the bills that pass are bipartisan, and we mostly hear about the ones that aren't bipartisan. What's a bill that you've worked on with a Republican that you would want to point us to that isn't one of the ones that you've talked about so far?
Oh, gosh. I definitely would say the child tax credit, right? Why am I coming up short right now? I will say I worked on a bill in the short session. It was actually a committee bill. And it was a bill that would provide legal services for immigrants to help them either to become citizens or just to kind of improve their status. Mm-hmm. And that had wide bipartisan support. And it was a committee bill, but I took a real lead role on that. It ended up not getting funded.
What about another instance where you have said no to a powerful Democratic interest, either a union or medical association or somebody that supports you and you've had to say, no, I can't vote with you on this?
I will say I got asked several things last week to carry or sponsor that I don't really want to talk about because I don't know what those bills will go with. But
what about a bill that went through in 23 or 24?
So the bill on workplace safety that was brought forward by the nurses. So in the end, I voted yes, but I cried.
Was this the staffing?
It's not it wasn't the staffing. It was to. It was
to increase the criminal penalties for assault.
Yes, against a healthcare worker to felony. And when it passed on the floor in 2023. And I voted yes because my ER doctor colleague said this is really important to me, Lisa, and I thought that was important to respect them. Yeah. I cried. I wrote a bill explanation, and then it came, and it didn't pass.
Why was it difficult? Because you felt like you're criminalizing mental illness?
Yes. Yeah, I have a mentally ill brother. I've talked about. Not that I'm expecting you to remember, but
he suffers from schizophrenia.
Right, and he's assaulted police officers. He's assaulted healthcare workers, all in deep psychosis. Mm-hmm. And I was like, oh, don't worry, this bill doesn't cover that person, but it never said it well enough to satisfy me.
Of course it does.
Right. So then it came back in 2024 in the short session, and we had a House Judiciary Committee meeting on it. And I was crying in the meeting, and I said, I will vote for this, but I do not like it. And then they pulled it. Not just because of me. Yeah. A lot of people felt. So I will tell you the nurses are looking at other ways to do this. They told me there'll probably be another felony bill, but they've heard loud and clear how much discomfort a lot of us have with that.
So you're clearly the perfect person to ask. Is there a better solution you can think of for because it just seems like we see so much violence in these hospitals.
Yeah, I think we need more staffing. I just think we need more staffing. I think, I just don't think changing to felony is going to make a big difference. And we've seen evidence that it is inconsistently applied, to people of color. And
how are you feeling about the nurse staffing bill, the implementation of it? Do you think we're doing a good job with it, or is it taking too long? Or
I have not been tracking that. I'll be really honest. I should be, but I haven't been.
From your perspective, would we be better off with 2 children's hospitals as we have now, or 1?
No, I've always thought we should have one children's hospital.
Yeah.
Yeah,
Because there's a dilution of
Right.
volume.
right.
So we have 2 because you get great reimbursement at children's hospital?
No, I think it's like a turf. I mean, when I worked at Emmanuel in 1994.
Uh-huh.
And they had just built their Emmanuel, it wasn't a hospital, it was a wing, and it was
Yeah.
really pretty, it was really nice.
Uh-huh.
And they said, Brian Lauer, who's the chair of pediatrics at Emmanuel, then said, we spent 3 years trying to come to a unified children's hospital.
Mm-hmm.
I think one of the things is most people felt like it shouldn't be up on a big hill that gets icy.
Mhm.
And the university was very upset about that. And this is what I heard, right? So that they just were not able to come to the table and find a location and a place that made sense. So absolutely we should be not diluting those services. And technically speaking, St. V's has a children's hospital. I mean, I think they've been designated.
Okay.
And we fought that really hard. Like, they have a pediatric ICU. I'm like, you gotta be kidding me.
Yeah.
And it's not very busy, which means, I don't think it's the best place for a kid who needs
Right.
an ICU.
Yeah.
So I will be curious with this merger, what happens in that realm, if that's going to be part of the discussion at some point. It isn't initially, but at some point.
Well, 2 level 1 trauma centers and 2 children's
Yeah,
hospitals.
right.
Yeah. Any further questions?
No.
I think we're done here, except we have one final question, which is, what were you best known for in high school? That's the question we're asking everybody.
Okay. I would say I was just kind of the diligent nerd. Like, I didn't play sports. I did speech and debate. I, was student council. I would just say that's probably what I was best known for. I kind of hung out with like the cooler kids, but I
Yeah.
was probably kind of nerdy.
Okay. Great. Well, thanks for coming in.